So let's discuss about conjunctival intraepithelial neoplasia. So here it is a slow growing tumor which is usually unilateral, and there are some risk factors: ultraviolet light exposure, human papillomavirus type 16, AIDS, and xeroderma pigmentosa. Histologically, conjunctival intraepithelial neoplasia are of three varieties. First, it is in situ. Okay, it is conjunctival intraepithelial dysplasia, where the dysplastic cells are at the level of epithelium. Second, carcinoma in situ. Dysplastic cell have involved the full thickness of the epithelium. First, they were only at the basal layer of epithelium. Now they have involved the full thickness of the epithelium. In carcinoma in situ, full thickness of epithelium is involved. Third is squamous cell carcinoma, where dysplastic cells have invaded underlying stroma. Clinically, we cannot differentiate between them, whether it's a dysplasia or carcinoma in situ, or it is a squamous cell carcinoma. Clinical differentiation is not possible. How is the lesion seen? So it is usually unilateral, slow growing tumor. You see a pink fleshy mass near the limbus or anywhere in the conjunctiva with dilated feeder vessels or corkscrew vessels over it. Okay. Now this mass may have a leukoplakia appearance, and it may grow and extend on the cornea. Okay. So how is the treatment? See, if the lesion is localized, then you can do excision and cryo. But if it is diffuse, then we cannot make out differentiation between the normal and the abnormal area if it is diffuse involvement. So in that case, you have to give topical mitomycin C, 5-fluorouracil. Okay. Enucleation in such cases is advised only if there is intraocular invasion. An accentration is advised in advanced cases with orbital involvement. Okay. So local lesions, you just excise them. Place a amniotic membrane or conjunctival autograft, and followed by cryotherapy. And if it is a diffuse lesion, we cannot excise them. You have to give topical mitomycin C or 5-fluorouracil. Okay. And there's some differential diagnosis of conjunctival intraepithelial neoplasia. As I said, it's a pink fleshy mass with a dilated feeder vessels. So it can mimic amelanotic melanoma. It can mimic atypical conjunctival papilloma or pterygium. Okay. Thank you.